Hi, my name is Patricia King, and I'm here today to talk to you about a sepsis care quality improvement initiative. Today, some of the elements that we are going to review are an overview of Banner Desert Medical Center, sepsis care quality ratings, the importance of improving sepsis care quality, some SMART goals to improve sepsis quality, state and national sepsis care policies, quality improvement tools and methodologies, quality improvement project stakeholders, sepsis care resources, applicable health information technology, strategic plan integration, gauging quality improvement success, and last, sepsis quality care benefits. Banner Desert Medical Center is located in Mesa, Arizona. Their mission is to make healthcare easier so life can be better. Patients at Banner Desert Medical Center are low or no income residents and typically reside in rural areas. Main services that Banner Desert Medical supports and offers the community include audiology, cancer, diabetes, ear, nose, and throat, emergency, endocrinology, endoscopy, heart, imaging infusion therapy, integrative therapy, intensive care, kidney lab, maternity, neurology, occupational health, orthopedics, palliative care, pediatrics, pharmacy, pulmonary and asthma, rehabilitation, sleep medicine, surgery, transplant, volunteering, wellness, women's health, and wound care programs and services. Founded in 1999, Banner Health is one of the largest healthcare systems in the country that operates in 6 states. Banner Desert Medical is one of 28 hospitals that operate under Banner Health. Cumulatively, Banner Health serves over 1 million patients. Patients include families and individuals of various sizes, ages, income levels, and all of them have the ability to obtain full-scale, affordable, and innovative health care at Banner Desert Medical Center. According to Medicare.gov, sepsis care quality ratings on a national level currently rank at 57%. The state of Arizona has an average rating for sepsis care quality of 50%. Unfortunately, Banner Desert Medical Center comes in at a meager 24% for their sepsis care quality rating. This is a huge concern not only for Banner Desert Medical Center, but also for patients and the community alike. So why is it important to improve sepsis care quality? Well, over 1.7 million adults in the nation develop sepsis, and 1 out of 3 hospital mortalities have found that a patient has sepsis. 270,000 individuals die every year from sepsis. The mortality rate of those diagnosed with sepsis in a hospital is between 25 and 50% of patients. This is alarmingly high, which further emphasizes the importance of timely treatment. According to the Joint Commission, sepsis ranks as the costliest illness in hospitals and imposes a staggering $17 billion of additional healthcare expenses upon healthcare institutions. Additional suffering from neglect of sepsis care can lead to staff hardship, turnover and terminations, additional legal fees, harm to Banner Desert Medical Center's image and brand, and patient mortalities. Poor sepsis care treatment can not only impact the current Joint Commission accreditation status that they have, but also their financials, patient outcomes, and the viability of the organization's success. To improve sepsis care quality ratings, 2 SMART goals have been identified and developed. The first is to identify the root causes of poor sepsis care protocols and to modify or develop modern protocols that will be continuously monitored to increase the percentage of patients who receive appropriate care for sepsis and septic shock, moving the baseline of the current 24% to 50% by December 30th, 2023. The second SMART goal is to create a multidisciplinary sepsis care champion staff team. This team will conduct a minimum of 2 mandatory sepsis prevention and control trainings annually to ensure that 100% of employees at Banner Desert Medical Center are trained with the proper processes and control measures by December 30th of 2022. As the year goes on and progresses, the new processes and updates in 2023 will be modified, and these trainings will go on and be updated and changed continuously year over year. Every state does not necessarily have different laws and standards or processes regulating sepsis care. Some of the states with the best sepsis care include Illinois, New York, Ohio, and Wisconsin. It's no surprise that they have stringent laws and good quality scores. Unfortunately, the state of Arizona ranks in the bottom 10 states throughout the nation for sepsis care. Not only do they not have state regulations or initiatives, but they don't mandate any specific guidelines. On a national level, there are standardization resources, tools, guidelines, and policies to support any organization in properly identifying, treating, and reducing mortality rates for sepsis. National policies that Banner Desert Medical should meet and follow compliance with include the Medicare and Medicaid Services Severe Sepsis and Septic Shock Early Management Bundle, the Center for Disease Control and Prevention Hospital Toolkit for Adult Sepsis Surveillance, and the Joint Commission Reducing Sepsis Mortality Targeted Solutions Tool. Most importantly, the one that Banner Desert Medical Center should lean in and heavily focus on is the Medicare and Medicaid Sepsis and Septic Shock Bundle, also called SEP1. SEP1 was instituted by Emmanuel Rivers and Sean Townsend, and in 2008 the National Quality Forum approved it, and in 2015 it was adopted by CMS. This tool is extremely important for clinicians fighting sepsis on the front line. Patients identified with sepsis or septic shock should be treated with the process immediately. Hospitals that serve Medicare and Medicaid insured patients must report the SEP1 success rates and findings to CMS to maintain compliance. This is extremely important to Banner Desert Medical Center because they treat those patients and receive funding for SEP1. Over 70% of process improvement initiatives fail due to overly complicated improvement processes, a lack of ownership and process responsibility, and the inability to adapt throughout the process, not to mention poor communication. In order to be effective, Banner Desert Medical Center should use 3 quality improvement tools and methodologies to improve sepsis care. The 3 tools that they should use include the cause and effect diagram, the Plan Do Study Act, otherwise known as PDSA, and a risk matrix. Benefits of properly executed quality improvement tools include the reduction of redundancies, improved efficiency of managerial and clinical processes, the elimination of wasteful activities and expenses, optimizing care to avoid patient harm, and recognizing problems before they occur. The cause and effect diagram supports the identification of root causes through problems that occur from manpower, materials, methods, Mother Nature, measurement, and machines. The cause and effect diagram is important because it identifies root causes, and that is one of the main concerns in SMART Goal number 1 is to identify the root causes of problems that are causing poor sepsis quality at Banner Desert Medical. The Plan Do Study Act tool is an excellent way to trial the implementation of change. It uses a 4-step model and trials change through planning, doing, studying, and acting. Benefits of utilizing the PDSA tool include increasing employee confidence, flexibility in adapting to change, identifying side effects promptly, and piloting change. This tool is great when the new sepsis care quality procedures are implemented. It can increase the culture of safety and provide staff the opportunity to learn together and reduce employee resistance. With the SMART goal to train 100% of Banner Desert Medical Center employees, this tool can excite and empower staff to attend their trainings, increase their confidence, and reiterate the importance of checklists and systems needed to reach ideal outcomes. The risk matrix tool is great because it applies quantitative risk value on risks and divides it by values into definite tiers and applies a numeric value to each of them based on their probability and impact. When there could be several root causes or issues that Banner Desert Medical Center is facing, this model can help them identify the priority issues, causes, and risks they're facing. It can be difficult to decide where to start, but this tool will do just that. It isn't a one-time tool and can be used over and over to identify risks, adding them to the matrix, ranking them, and deciding how each one should be utilized to reduce. To move forward and develop the team who's going to implement the quality improvement project, stakeholders must be identified both internally and externally. Healthcare stakeholders are individuals or organizations with an interest in or what is impacted by the quality measure, and in this case, sepsis care. All of the different internal and external stakeholders that should be involved in this project include administrative or IT staff, board of directors, clinicians, ER staff, leadership staff, nurses, patients, pharmaceutical companies, pharmacists, regulators, risk managers, sterilization technicians, and vendors. All stakeholders must come together to share their role, what protocols and procedures they currently use, and how they are controlled or even not controlled. Once quality improvement and risk management findings are identified, the team should collaborate, collect data, and reflect on how they can improve sepsis care. They can then utilize the quality improvement and risk management tools and methodology findings to identify and agree upon improvement interventions that they collaboratively will need to apply, monitor, and continuously improve. Many resources are needed to support sepsis care throughout the hospital, or even outside of the hospital. Elements include cleaning supplies, diagnostic equipment, health information technology, overhead costs to ensure that staff are available, facilities are on and operating, electricity, pharmaceuticals for treatments and medications, time for staff allocated to attend to patients and treat patients, in addition to sepsis care training materials. Health information technology, otherwise known as HIT, is also critical for sepsis care. Patient portals, applications, and texts can support an expedited communications between patients and clinicians. Algorithms, alerts, and automations embedded into HIT can also support in the identification of early sepsis, which can prevent shock and reduce mortalities. Health Language Clinical Natural Language Processing Tool is one of the main tools that supports HIT in the early identification detection of sepsis, derived from non-standardized data that's found in medical notes, indicating immediate warning signs of sepsis. The Quality Improvement Initiative to increase sepsis care quality at Banner Desert Medical aligns precisely with their strategic plan. It aims to support growth, quality, service excellence, customer engagement, and health management. Improving sepsis care will do all of those. It will grow patient population and brand. Quality scores will improve. Service excellence and patient satisfaction will improve. Customers will be more engaged through the patient-centered approach and the process, and health management will be better aligned and processes will be mainstreamed. To gauge quality initiative success, it's important that ongoing monitoring and evaluations are conducted. Without terms of measurement and quality, it's impossible to establish whether new processes or procedures of quality improvement interventions even work. Medical should measure and utilize monthly dashboards evaluating the SMART goals' success, the root causes that they identified and how they have changed month over month, quality rating scores month over month. They can evaluate sepsis readmission rates in addition to sepsis mortality rates. Over time, all of these ratings should progressively improve until they reach the SMART goal end date objective. Sepsis care will reduce patient mortalities, minimize expenses, support in the maintenance of accreditation, and ensure organizational viability. Banner Desert Medical Center must implement a comprehensive sepsis care quality improvement initiative to increase their sepsis care rating, to decrease patient mortalities, reduce excessive sepsis-related expenses, maintain healthcare accreditation, preserve organization profitability, and ensure success.